Today, as you can see from the title of the video, it's not me saying Brexit. Guess I told you so. It actually comes from a interesting blog that I found called Pathos, or a tipping philosopher, who basically said Brexit can't say I didn't warn you, and we'll dive straight into this because this is a long one today. But I agree with him, and these were talking points we've talked about continuously on this channel again and again and again. So if you don't happen to stay for the long haul, that's fine. You can listen to it on your own time, but please do like, share, and subscribe to the channel. It does help every little bit. Also, there are links down below should you like to help the channel in another way. Anyway, on with it. So, Brexit seems something of a distant past, a bygone era. It has been eclipsed by a global pandemic that has led obstinately to let Brexiteers and Leavers completely off the hook. There was a number of things that I clearly predicted that would come about, and all my predictions are coming true. Here are the main things I predicted. 1. A recession would take place. 2. Health and safety regulation would be stripped away. 3. Workers' rights would be stripped away. 4. Environmental regulation would be stripped away. And 5. NICE would be dismantled in a trade deal with the US. So let's look at each of these in turn. Recession. The UK is now officially in a recession. And not only that, we have the worst performing economy in the G7 as of 10 days ago. Another argument popular with backbench Brexiteers and now prominent among ministers is that the belief that the coronavirus presents the government with an opportunity to bury the loss of growth from a no-trade deal under the cover of a much more dramatic drop in GDP caused by the coronavirus. A recession as a result of Brexit was never in doubt, but there was always going to be able to be said, "I told you so." The moment from people like myself to ardent everything will be fluffy clouds and gold leavers. But it will never happen because Brexiteers will now always be able to cover up the Brexit recession with pandemic excuses. There will be no EU safety blanket and pulling together to get through it because the UK is firmly on its own. Regulation or deregulation? Perhaps the most important driver is the belief among ministers that the UK economy will be permanently reshaped by the crisis as companies create new supply chains and reshore production to provide greater resilience in the future, not in least case of another pandemic. The government wants a free hand to facilitate this change, and one it believes that could be constrained by the EU's demand that the UK remain tied to its labour and environmental standards and state aid rules, says a source. So clearly, deregulation is the order of the day. For decades in Brussels, Britain has pushed harder for deregulation than any other in its European counterparts. The Brexit campaign has been underpinned by a constant argument that Europe enforces burdensome and costly regulations, ignoring how these regulations protect British people. The laws are redrawn in the aftermath. As laws are redrawn in the aftermath of Brexit, it will come as no surprise to see the deregulation agenda pushed even further. These are already grave concerns about possible financial deregulation and about the type of trade deal that the government will seek with the EU. We are facing a climate emergency which will require more regulation, so this agenda is a significant threat. Brexit may face poor economic conditions following its exit from the EU, which have historically been exploited by multinational corporations who lobby for weaker working conditions, less corporate regulation, and lower environmental standards in an economy like Britain's, which prioritises deregulation as one of its core ideological tenets. This is a significant threat. And we already know that with the US wanting to lower food health safety regulations than the EU, the US will be pushing for the UK to adopt the lower standards in a bilateral agreement so that the more powerful US will be able to sell more of their goods to the UK. Hence the whole argument over chlorinated chicken that we appear to be losing. George Minbot pointed out this and more in Boris Johnson's US trade deal will make Britain a paradise for disaster capitalists. You may remember that, we went over that. Chlorinated chicken is just the start. The government intends to rip up food standards, public services and public protections. It is not if our standards are wonderful, but by comparison to the revolting practices in the US, our food rules laid down by the European Union are a heaven of sanity. As well as washing chicken flesh with chlorine to compensate for the filthy conditions in which it is raised and processed, and injecting dangerous substances into cattle and figs, Big Pharma and Big Food in the US use 72 pesticides that are banned in the UK. Food colorings that have been linked to hyperactivity in children, impose no limits on the amount of sugar in baby food, and permit cow's milk to contain twice the amount of pus than the UK allows. What this all means is that we will bring into this country food whose production is banned here. Either our farmers and food processors will be outcompeted, or our domestic production standards will be brought down to match. Some Conservative MPs attempted to insert an amendment into the agricultural bill last month to uphold the manifesto promise, but it was decisively slapped down by governmental loyalists. The bill returns to the House of Commons on Wednesday. The US government argues that these matters should be left to consumers. We should allow each to decide whether we buy cheap vegetables containing residues of pesticides that are banned here. But I suspect rather than having to read and interpret the labels on anything, from what we buy from shops, takeaways and restaurants, most of us would prefer to know that all that food is safe to eat regardless. Anyway, just in case that we did try to exercise such a choice, the US also insists that useful labelling will be banned. Perversely, it is argued that warning labels are harmful to public health. To make matters worse, the US is likely to insist that a deal is enforced by an offshore tribunal, which allows corporations to sue government if domestic law affects their future anticipated profits. This mechanism has been used all over the world to punish nations for laws and parliaments that they have passed. It ensures that over time, legislation everywhere has to be tailored to the demands of a corporate power. Far from taking back control, trade deals along these lines with the US involves a massive renunciation of sovereign power. The government knows that accepting such a deal means no deal with the EU. US food rules are incompatible with EU standards. In a leaked document, US officials remarked that there would be all to play for in a no-deal situation. I suspect our government sees it the same way. The pig-headed obstructionism from the UK in the current EU talks is at stark odds with its willingness to prostrate itself before US power. The list goes on. From where we will be compromising in terms of regulation in every sector. By compromising, I mean racing for the lowest common denominator. Workers' rights, because that's the big one. The Brexit Institute sets out the playing field. Undoubtedly, the withdrawal from the EU poses a number of formidable challenges for UK employment law. Many of the UK workers' rights hinge on a substantial body of EU primary. In addition to treaties, the EU Charter of Fundamental Rights is one particular salience in living institution for human rights and protection, and secondary legislation and their exercise has been strengthened by the jurisprudence of the Court of Justice of the European Union. Even though the court does not always consider social rights in its cherished offspring, it has held at times that EU labour law also applies in the interests of business and employers, and it nevertheless delivered some rather bold rulings that have strengthened the level of protection of workers' rights and expanded the scope of social rights. It should be recalled that EU law offers a higher level of protection because it guarantees individuals the right to an effective judicial remedy, and also requires member states to ensure adequate protection of EU rights in line with the judgments of the ECJU. Hence, it can be readily seen the extraction from the UK from the EU potentially causes a serious disruption of British workers' rights, precisely because they would be deprived of another layer of protection. However, there is growing consensus that at least some employment rights will be weakened. Therefore, it seems we are likely to see the erosion of rights related to working time, paid holidays, agency workers, protection against forms of discrimination, health and safety, and collective consultation on issues such as redundancy. The problems are made worse by the constant attacks on unions and the strategic approach to deunionisation by the Conservative governments as the University of Plymouth piece continues. The problem of enforcement is made more acute by the erosion of structures of employee representation and voice, declining union density and shrinking of collective bargaining over the last 35 years will been well documented, but crucially, there is little evidence of alternative sources of employee voices filling this gap. Ironically, the global pandemic has been an opportunity for the world to tighten employment regulation to protect workforces from the hardest hit communities. Now, our government has done none of that. And of course, trade deals. We know that the pandemic is being used to cover up a no-deal Brexit, which means we will come out of the EU, in which we've had one of the best deals possible. Outside of the EU, and we will need to do a deal with the EU countries obviously, the EU currently has 41 trade agreements covering 72 countries, and we are no longer part of those. Trump accidentally made a faux pas when he was last in the UK, saying the NHS was on the table for trade talks before having his knuckles rapped by aides and sort of rescinding it. What will be on the table, will be the detriment of the UK population, is of course nice. The US corporations and Big Pharma aren't interested in running hospitals. No, they want a far easier and more lucrative target. The UK has gone from supposedly being fettered to the EU to being a whipping boy for the US, with no power to stand up for ourselves. The safety blanket of the EU has been ripped away, and we lie here prostrated, naked and powerless in the shadows of larger nations. The environment. On areas of most concern, since it is unable to stand up for itself, is the environment, and lo and behold, the evidence is already gathering that Brexit is having an impact on environmental legislation. Environment Agency supports plan to weaken river pollution rules. The head of the Environment Agency has endorsed a proposal to weaken laws on cleanliness of polluted rivers and lakes and coastlines after Brexit. During the referendum campaign in 2016, the Secretary of State for Environment, George Eustace, called for key EU nature directives to be scrapped once the UK left the EU, and things were already looking bad in 2019. Environmental lawyers have condemned the UK government's proposed Brexit deal ahead of tomorrow's parliamentary vote as being a serious risk for the environment. Scrutiny of the updated withdrawal agreement by legal experts from Client Earth has revealed that the crucially legal binding protections are now gone, resulting in a risk of lower environmental standards if the deal passes. This in particular is a particular concern to the UK, and it was under pressure to deregulate from trade deals with countries such as the United States. Client Earth has global programs, and its counsel, Clara Hill, said that this deal unilaterally fails to guarantee the future of environmental standards in a UK post-Brexit. The binding part of the agreement contains nothing about environmental standards across the UK, and the new non-binding political declaration merely notes the parties should maintain environmental standards. There is a concerning lack of detail as to what this actually means in practice. Should this deal pass, our environmental protections will be at huge risk of being watered down by deregulation. And when coupled with the environmental bill published this week, which also fails to provide a legal block on the regression in environmental standards, among other flaws, it paints a bleak picture for the future legal environmental protection in the UK. And now, finally, on to nice. American drug prices are some of the highest in the world, leading to economic hardship and poor health outcomes for uninsured Americans, of those who cannot afford to pay out of pocket. The US government does not negotiate drug prices, and Medicare is prohibited by law from doing so. In addition, the Affordable Care Act prevents US Food and Drug Administration and the Secretary of Health and human services from basing drug approval decisions on cost effectiveness. By contrast, similar drugs are often significantly cheaper in the UK, where the government negotiates prices with pharmaceutical companies via the Pharmaceutical Price Regulation Scheme, and NICE makes purchases based on clinical and cost effectiveness assessments from the UK's National Institute for Health and Care Excellence. In May of 2018, the US Department of Health and Human Services introduced the American Patients First Blueprint, outlining measures to reduce US drug policies and prices, which include putting pressures on other countries to allow drug prices to rise in their jurisdictions. Unveiling this new policy, President Trump stated that as we demand fairness for American patients at home, we will also demand fairness overseas. When foreign government extorts unreasonably low prices from the US pharmaceutical companies, Americans have to pay more to subsidize the enormous cost of research and development. And when the American Patients First policy and a turn towards protectionist, pro-America trade deals, the authors believe that the USA will push to alter drug regulation in a further negotiations with the UK. This raises concerns because the ability to enter into trade deals is an executive power in the UK. NICE are the National Institute for Health and Healthcare Excellence and are a non-departmental body who decides on what drugs and treatments the NHS should use, i.e. how much they should spend on a given treatment. NICE have a formula for assessing different treatment pathways, for example. Typically, the health economic analysis will have looked over a variety of elements to determine the incremental cost of per quality adjusted life year, gain to calculate the cost of the health economist uses to estimate unit costs and the level of service. These costing tools include whether the relevant and the same cost active levels and assumptions to ensure consistency. What this essentially means is that there is the cost limit whereby NICE says to the NHS, we're not going to advocate this treatment as it's too expensive. This actually happened with me. There were no drugs for primary progressive multiple sclerosis last year at all because NICE turned the Oculus manufacturer away for being too expensive. They came back several months later with a lower price and more data, and NICE finally accepted it. For the point concerning this article, it turns out that 25% of the world drugs purchases are benchmarked against NICE. So in a post-Brexit trade deal with the US, NICE will be the first thing on the table. Mark my words, getting rid of NICE will be a massive problem for the health system and taxpayers in the UK and 25% of the world, but will be a boon for the US drug companies. And I can't stress how important it is. And also, this allows Trump to retain his reminding of his statement about the NHS, since NICE are not officially part of the NHS. So, what can we learn in conclusion from this? Brexit was entirely about elites and vested interests telling you it was all about sovereignty, whilst merely intending to reduce health and safety and environmental legislation, so that those vested interests and elites could line their own pockets, and the public fell for it. It's happening. Can't say I didn't warn you, and don't expect the excuse that it was the pandemic what did it. It doesn't wash with me. You'll need much more chlorine for that. I can't agree with him. You know, we've been talking about these for how long on this channel? You know, just backs up more and more of what I've been saying. It's going to cause huge problems for this country. But, you know, unfortunately, large sections of the public were conned into voting for it. You know, hopefully they'll realise what the problem was and realise that actually we need to get back into the EU. And I've said this before, all paths lead us back to rejoining the EU. It's just a matter of time.